So I just want to say again, welcome everyone. Thanks for coming on this very cold morning, and happy Friday to all of you. My name is Betsy Weir, and I work at the One Health Institute here at CSU. And we have been offering monthly seminars, and it sounds like people have started to catch on to that. So pay attention. We're going to have another one in November, and then we'll continue in spring semester also. The topics vary, so we'll be getting those out, and that's why we asked all of you for your information, and we'll make sure that you're on our distribution list for the upcoming seminars. I also want to let you know there's an evaluation form that we put on the seats, so please fill those out, and you can just leave them on the seats. We'll pick them up so that we know how we're doing with the seminars, and if you have suggestions for future seminars, we'd love to hear what your ideas are. And we will have a Q&A session with Brooke, Dr. Anderson, after, so definitely think about your questions so that we can have a nice discussion with her after her presentation. So just to give you a little bit of context, I invited Dr. Anderson here today to present on tropical cyclones and human health as an example of climate epidemiology. And as those in the room know, that climate epidemiology combines climate science with analysis of health impacts on people and could even involve animals as well in those studies. In the context of climate change, obviously predicting health impacts is no easy task, with ever-evolving unprecedented heat waves, like we saw this summer globally, also drought, extensive fires, like we witnessed in Paradise, California. I don't know if you saw the news this morning, happening again in California. So if you didn't hear that this morning, you might want to listen to the news later. Also superstorms like Hurricane Harvey that flooded Houston, and Dorian, a Category 5 hurricane that razed the Bahamas. Some of the health implications of these events, like many others worldwide, are an increase in heat stress-related illnesses, and respiratory issues, vector-borne diseases, and infectious disease presenting in ways we've not exactly dealt with before and at a much larger scale. So the way that we approach public health must change in terms of prevention, risks, and support for vulnerable groups. So Dr. Anderson is an assistant professor of epidemiology in the Department of Environmental and Radiological Sciences here at CSU. She's also a member of CSU's Partnership for Air Quality, Climate, and Health, or PATCH, P-A-C-H is their acronym. She has a PhD in environmental engineering from Yale, and postdoctoral work in biostatistics with the Johns Hopkins Bloomberg School of Public Health. She also has developed R software packages to facilitate environmental epidemiology research, which I'm sure she'll probably touch upon today. And as you've gathered, her research focuses on health risks associated with climate-related exposures. She's published a lot of really interesting articles. If you go to her faculty bio page, there's links to them there. There's a recently published article in May of 2019 in the American Journal of Epidemiology, and it's called "The Future of Climate Epidemiology, Opportunities for Advancing Health Research in the Context of Climate Change." So that's spot on, so definitely check out that article. So without further ado, I'll let Dr. Anderson take it away and thank her for presenting today as part of the One Health series. So thank you so much, I appreciate it.
Much. Did I manage to get it on? All right. It's a great pleasure to be out here and to talk about this. And what an interesting group of people. I'm so glad that we've got the mix from atmospheric science through to public health. So I'm going to talk about tropical cyclones and human health. And I think one of the great pleasures of being a scientist is that you get to see things that have happened in your field that have changed hundreds or thousands or millions of lives for the better. So I want to start with one of those for hurricanes, because I think this is certainly an area where we've had a huge improvement, and this brings in atmospheric scientists and public health folks and communication as well. So I want to start with a story about a hurricane in 1900. This was a storm that formed and passed over Cuba, a little bit weaker, I believe, than a tropical cyclone a hurricane at that point, more of a tropical storm. At the time, Cuba was one of the centers for tropical cyclone expertise, and so they let the folks in the United States know that this was coming. what has become the National Weather Service in the United States was pretty sure that it was going to follow the path of a lot of the other storms that had crossed over Cuba and come up along the eastern coast. And so they started kind of warning folks down there and doing some preparations, but they didn't think it would be that severe of a storm. Instead, it took a bit of a left hook and rapidly intensified, going from kind of the A to the D right here. It changed to a category 1, 2, 3, and then 4 storm as it crossed the Gulf. Because we didn't know which way it was going, it was aiming right towards Galveston, but they had no idea until it was upon them that there was any storm coming. The results for this were absolutely devastating for Galveston. I apologize, the resolution of this is a little bit low, but hopefully you can see the gist of it. The highest point in Galveston at the time was about 9 feet above sea level. The storm surge was 15 feet. It inundated the whole island. About 20% of the population was killed by this event, and almost every building, if not every building, was damaged in some way, many of them completely destroyed. The picture looks really different today for those storm surge directly at the coast kind of impacts. And this is thanks to huge advances from the atmospheric science side and the technology side in terms of how we can identify, track, and forecast these storms, and also in how we communicate in the public health interventions that have been taken to try to get people out of harm's way when we know one of these is coming. So this is a recent example of a storm coming to threaten the coast of Texas. And you can see now we have all kinds of clear information that we get ahead of time. In this case, we've got a forecast of the track of the storm, where and when it will hit, and at what intensity in terms of the wind speeds. We have warnings for coastal areas, and we even have other information about other hazards of the storm, things like the rainfall totals. And so we have information ahead of time now that can help in preventing some of these. This is something coming out. I grew up in Suffolk, Virginia. This is right next door to my hometown. Coastal areas that are affected repeatedly by hurricanes now will often have information outside of the hurricane season to help people think when that crisis comes of what to do. And so this is some information outside of that season to check and see which evacuation zone that you're in. And then during storms, coastal communities now communicate a lot of information. This is from Nikki Haley when she was the governor of South Carolina, I believe, about Hurricane Matthew, and talking about how to go and check and see whether you should be evacuated based on where you lived. The result of this is really quite striking in terms of the public health impacts, again, for right where the storm hits. So this was done by the Houston Chronicle a few years ago, and it gives the number of deaths attributed to different storms in the United States. You can see up at the top is Galveston with around 8,000 storms, although that was so severe it's very hard to estimate exactly how many there were. But the thing I really want to point out here is the dates on this. If you look through and look at the dates on these, there's only one storm on here that's in the 21st century, and that's Hurricane Katrina. And there's only one other storm that's even since the 1960s, and that's Camille. And in both of those cases, those storms, many of the mortalities from them were not right at the coast where it made landfall from the extreme wind and the storm surge there, but rather they were inland for more complex causes. So in Hurricane Katrina in New Orleans from the levee failures. And in Camille, many of the deaths were actually in Virginia in the mountains where the rain from the storm triggered massive landslides. And this is in the midst of massive population movement towards the coast and growth in those coastal areas. That's not to say that these aren't still risks today. NOAA does the billion-dollar disasters that have occurred every year. These are the ones for last year. And you can see that 2 hurricanes made the list, Hurricane Michael and Hurricane Florence. And these 2 hurricanes really capture how different hurricanes that cause massive damage can look. Hurricane Michael was a very, very strong storm in terms of the winds. And moved quickly through. And then Hurricane Florence wasn't so strong in terms of the category, but it came and it sat over eastern North Carolina and caused massive flooding there. The kind of impacts that we get now, we can get people out of harm's way in many cases because of these improvements in forecasting and communication and public health planning. But we still have things like widespread building damage near the site of the landfall, and we have wider spreading outcomes from this as well, impacts, including a lot of power outages And further from the center of the storm, you can have massive flooding and tornado damage, so some of the other hazards of the storm. So these are a concern today, and I'm going to get back to talking about the health impacts, but I wanted to take a minute to talk about what things might look like in the future with these. One of the other impacts or climate-related health risks that I study is heat waves. And there the picture is quite clear that we expect throughout the United States that with climate change over the next century, we will have more dangerous exposures, and so we need to think about what to do with those. With hurricanes, it's been a little bit trickier from the atmospheric science side. It's a little bit hard to model some of these storms, but some of the research coming out, it seems that for Atlantic basin storms, the ones affecting the eastern part of the United States, that those may become more intense with time. One area that's pretty current for looking at this is something called attribution studies, and there's some interesting ones that have come out for Hurricane Sandy that I wanted to talk a little bit about. So this black line here was the track of Hurricane Sandy, and it came in 2012 and hit New Jersey and New York areas with very high population and caused a lot of damage and also health impacts there. This study went back and assumed that we had the storm with its true characteristics right at this point when it was around Florida, out to the east of Florida. And then they took some slow-changing characteristics like sea surface temperature that can be impacted by climate change. And they took the forecasting models that we use in real life to try to determine and forecast where a storm's going to go. And they applied those forecasting models under different scenarios. First of all, the green line shows what they got when they used the sea surface temperature and other characteristics as of 1880, so before the influence of anthropogenic climate change. And then the blue is under the conditions that we have at present, and the red is the conditions under one scenario of climate change out towards the end of the 21st century. And you can see one thing they concluded from this is it looks like the influence of climate change on things like sea surface temperature might drive storms like this to make a landfall that's further north. You can see this is going up further north as you do those different scenarios. And this is moving it into areas that might not have experienced as many of these storms in the past and where they might not have they might not have had the chance to harden to the storms quite as much. The other thing they looked at was the intensity. This is measuring the minimum central pressure of the storm, and that's very closely aligned with the wind speeds, where a lower pressure tends to be associated with stronger wind speeds. And you can see again here that what they were finding was that they're forecasting a stronger storm as they move out to some of the conditions under the scenario of climate change. All right, so I'm going to go back, and for the rest of this talk, I'm going to talk about the health impacts of these storms. And I could probably talk all day about the different things that can be affected in terms of health during tropical cyclones. So I had to pick just a small sample, and I kind of categorized these in two groups. First of all, there are a number of health impacts of hurricanes that it's pretty clear that we have characterized very well. We've studied these, we've identified them in previous storms, and we have a pretty clear idea that they're happening and to what extent. So I'm going to talk some about those where we know about them, but they are hard to prevent. They're hard to avoid. The other type, and we're doing a lot of research in my research group on this, is ones that are hard to even characterize in the first place, hard to detect the extent, and in some cases we know that they're happening, but what the exact level is. All right, so for the ones that are hard to prevent, again, because I had to sample just a few, I picked ones that are related to that interface of animals, humans, and the environment, since this is One Health. So to start talking about this, I want to point out how much damage, how severe the damage can be from some of these storms. In my lifetime, one of the most severe in terms of wind speed storms to make landfall in the United States was Hurricane Andrew. It wiped out entire neighborhoods. There were people who responded to this who were in the military or had been in the military and said they could only compare it to scenes they had seen in the war. Extreme destruction from that, and you get similar levels of destruction during flooding, or you can get some level of destruction during flooding. And all of that requires the people living in that area and the responders to take a lot of time to clean up after the fact. Now, these storms move animals, and then they move people outdoors into areas with a lot of debris to clean up. And one of the things that they run into are animals that we hope don't usually meet up with people. The cottonmouth snake is one, again, I grew up right around here, and this was one that hung out in our backyard a lot that I'm not particularly fond of. But if you look at its range, you see this is a very similar range to where we see some of the main impacts of hurricanes. You see evidence of snake bites increasing if you look through things like CDC when they go through and talk about the impacts that they observe for a storm. But you also just see it in the media and immediately after the storm with some of the cities trying to prevent that. So this is coming out after Hurricane Irma from the city of Jacksonville in Florida. And they had done a tweet earlier that said, "Be alert to wildlife, snakes, alligators, etc. may have been displaced as a result of strong winds and rain." And then they're following up. There have been reports of an increased number of snake bites in the city, so make sure you're looking out for those. These are some from this year. So Hurricane Barry, talking about snakes and other critters being a big risk. And then Hurricane Dory, a woman in Hilton Head, South Carolina, getting bitten by a copperhead as she cleans up. So these are ones that we know about. They're not surprising probably, but they are a little bit hard to prevent. You have this unusual situation where you need to clean up a lot and where you are outdoors in areas that you maybe don't want to be and where there's a lot of water and where the conditions have driven these animals out of their normal habitat anyway. And so you get an interface of animals and humans. So hard to prevent even if we know about them. A little further afield, a lot of people attribute much of the python problem in southern Florida to Hurricane Andrew. So they'd already seen some pythons in the Everglades before Andrew hit, but it wasn't loads of them. Some of the buildings that were destroyed by Andrew included breeding facilities for exotic animals. And there were many more sightings of these after that event. And so that's one area where they think that that might have been a key trigger in moving that forward. And that's had huge, huge impacts on the ecosystem in southern Florida to the point where now they do these competitions with going out and trying to bag the biggest and a lot of things to try to reduce that population of a non-native species. So it's not just wildlife or exotic animals. You also have issues with domestic animals. A lot of times people evacuate and cannot take their animals or they might get loose during the storm. So a lot of times you have animals that are scared or displaced. And there are some cases of increased dog bites and other domestic animal interventions. Down here, moving from dog bites, this is from the CDC. It's the title of one of its pamphlets for how to take care of yourself after the storm. And if you look after dog bites, the next one that it has is West Nile virus. So that's a concern because, again, more people are outside trying to take care of this, and also you have conditions that can be good for the breeding of some types of mosquitoes. I don't believe that the breeding for the species that carries West Nile increases, but some other types certainly do. There was one study in Katrina that looked at West Nile specifically and found that it looked like there was an increase after that, although this is still a little bit uncertain. There's been some research out of Fort Collins. We have the CDC branch for vector-borne diseases out here, and there's been some research there where it's a little less clear if there's a link. But again, the hypothesis there is that it's not much about the mosquitoes, rather it's about the people changing their behavior to go out and clean up after the storm, and they're putting themselves in a place where they're more exposed. In either case, as a result of these increased populations of mosquitoes, often people will do spraying campaigns after a major storm to try to bring those populations down. And that's exposing people to other chemicals. And again, they're outside where those exposure levels might be even higher than they would normally be if you did that spraying. All right, so moving on to another topic with animals. This one, again, is very dear and near to my heart. So I grew up on the other side of me from Norfolk, which I showed before, is Smithfield, which is home of the famous Smithfield ham, a delicacy, I believe. And I just went this summer, and we took some friends to the Outer Banks of North Carolina, and they were very confused because they thought we were going to eat a lot of seafood, and my husband and I feel the delicacy of North Carolina's barbecue pork barbecue. And so we ate a lot of that, and they weren't sure about that, but that's just what you do in that part. So it's a big part of the heritage in this part of the country. And a lot of the hog operations are still run by families, family farms, and at this point they contract with Smithfield Foods, so there is a corporate element to it, but a lot of these are not large corporations that have a lot of money. They're operating on a pretty narrow margin in terms of making a profit. The way that they keep these animals, often they'll keep 1,000 or more on a farm, and they keep them in these long hog houses. And then the waste is treated through a lagoon system where the waste comes out of the hog houses through slots in the floor and then comes out into these large pools where they have anaerobic bacteria that break some of that waste down, and then eventually it gets sprayed on as fertilizer on some of the crops. And this is a low-cost solution, again, for people who are keeping and breeding these animals and bringing them up to the age to go to market who are operating on a pretty slim cost margin, and where this is a kind of a family heritage thing. Well, these don't work very well once it starts flooding. This happened my first semester of college. I went to NC State, so this was very much on everybody's mind. The floods came in, and a lot of the floods picked up even 2 or 3 days after the storm itself passed through. It flooded these rivers, and as everything came back down the river towards the sound and towards the ocean, it flooded everything. And so here's some of those long hog houses. This green area is the kind of like elevation around that hog lagoon. And you can see that everything with that hog waste that was processing there is now flowing out into these floodwaters. It also, I mean, clearly the flood waters were very high. Many of them came up to the top of the hog houses, and so there were many, many animals that were killed, thousands of animals. And so those carcasses also had to be cleaned up and were another source of contamination in the floodwaters. One person did a study with Medicaid of the outpatient visits for intestinal disease after that. They found in the most affected areas that there were increases in nonspecific causes, and for a couple of pathogens, there were increases that they could specifically link, small increases, to specific pathogens. Some other research since then has looked at well water in the area and found that some of the private wells serving homes in the area had some evidence of pathogens that were maybe linked back to this. So that was 20 years ago now. Hurricane Florence came through last year. It hit a little bit further south, but we're seeing the same problem. This is despite the fact that we know that it's a problem, and there has been a lot of work out of NC State on trying to come up with better solutions for this, but it's a tough problem to tackle because they haven't been able to find anything that they could do at a similar cost that would work a little bit better. So here, the green dots are showing hog facilities along the east coast of the eastern part of North Carolina. And then each of these bars is at a river gauge, and it's showing the level of flooding. And you can see this is all happening right in the same area. And indeed, they ended up with over 5,000, or around 5,000 animals dying in this same case, where we're getting a lot of flooding of these hog houses and then the lagoons that are used with them as well. All right, so those are some of the things that we know about that are clear, that have been characterized, but are pretty hard to prevent. We know that we need a solution for them, but it's a little unclear what that might be. The next part I want to talk about dips some into my research, and these are areas where I think it's hard for us even to measure well what we might see. So I want to start by talking a little bit about how we measure deaths, the death toll from a hurricane or tropical storm. There are codes that are used in public health called ICD codes, International Classification of Disease. And there are specific ones for exposure to forces of nature. Those include things like cataclysmic storm and flood, and a more general category. And so these can all go on to coding to be able to link storms, or to link deaths to some of these extreme events. These get figured out based on death certificates. So I know this is a little small, so I'll walk through and read the important parts to you. But when someone dies in the United States, somebody fills out a death certificate for them, and it'll have a section on cause of death. That includes several lines, not just one. The first line will be the most immediate cause of death, but it also has room to talk about things that were related to it. So in this case, the main cause of death is an acute respiratory failure, but then it goes through and talks about some of the things leading on to that. So due to or as a consequence of severe emphysema, and then below that it says that it's also due to or a consequence of heat and loss of air conditioner power from a hurricane. So in this case, the person filling this out could clearly make the story of how this death likely would not have happened, at least not that day, without the storm. But the issue is, it's not always as clear for each death to be able to make that story, especially for things that happen frequently, like respiratory and cardiovascular deaths. So as a result, I think that we capture probably really well things like accidental deaths, the direct deaths caused by the storm. This is from Hurricane Andrew. It's listing out some of the direct deaths from that. And you can see many of these are from blunt trauma, so when a building collapsed and a person was caught within it, or from a crushing kind of asphyxiation. Again, many of these are associated with building damage. This, again, was a storm characterized by strong winds and a lot of damage to buildings. And then some as well that are related to drowning. Now, we know that there are some of these more common causes of death that are linked through an indirect path, like cardiovascular causes. This is also from Hurricane Andrew. And you can see that they have some causes listed that are things like while they were being evacuated from a home, there was a heart attack or other cardiovascular event that caused the death. But also things that are happening in the 2-week period after the storm where they're trying to clean up. So some of these are trimming trees, chest pains while sealing a window, collapse while driving to bring supplies. This person, who's 42, seems to maybe have been a worker for the utility company. It specifically says working 15 hours a day for 13 days restoring electrical power when he had the cardiovascular event in this case. So we know those are out there, but it's really hard to know if you're capturing all of them. This really came out clearly with Hurricane Maria in 2017. This is an analysis that was done by the New York Times, but several other groups of biostatisticians and epidemiologists and other researchers have gone back and confirmed a lot of this and dug deeper. These gray lines show a smooth value of the mortality rate, the mortality counts in previous years, the 2 years before the storm. A lot of times there are seasonal patterns and things like that, so we want to look at that when we're trying to explore this. The red line shows what was happening the year of the storm, 2017, and then here's when Maria makes landfall. And you can see that the number of deaths increases substantially above the pattern that we saw for the year before and stays up for quite a while after. If we look at this in terms of the cumulative, kind of adding up the excess over time, down here at the bottom is the official death toll. And this is based on that kind of analysis like I showed for Hurricane Andrew, where each of the deaths, there was a clear story linking through for why it was associated with that storm. The final death toll at the end of this period, about a month after the storm, was 64 deaths. This top line shows that difference between what you might have expected based on the pattern before and the pattern from previous years and what they saw during that storm. And you can see that this is much higher and just keeps on growing. It was an order of magnitude higher than the official mortality count. And many of those deaths are people who are older or from causes that are otherwise common where it might be hard to link them to the storm. Eventually, based on this analysis and the analysis of a lot of scientists, the official death toll was changed for this storm to up over 1,000 deaths. That will put it, I should note, in that chart up near Hurricane Katrina that I showed earlier. This is a tweet that came out about this time last year from Rafa Irizarry. He is a biostatistician at Harvard University, and normally he does a lot of work on genomics and things along those lines, but he's from Puerto Rico, and this is very close to his heart, I think, and so he's done some research on this storm. And this is a tweet out of some of their preliminary research. They published some stuff on estimates of the total counts of deaths, but they're also digging in and trying to see what causes it's from now. And so they're seeing that the top cause of death is from circulatory system related outcomes. And then they've got endocrine diseases and nervous system diseases and respiratory. It's pretty far down before you start getting to external causes and then down to things specifically linked to the storm. Some of the classic things that we have characterized well about the association between health outcomes and the storm. It's not just the storm. Hurricane Sandy was a massive storm that came in and hit a very highly populated area of the United States. And that gave researchers the statistical power to look at a lot of outcomes in that area. And they looked mostly at non-fatal outcomes, but they found a lot of links with these kinds of long-term things and in susceptible populations. So things like changes in the pattern of emergency department visits, food and waterborne diseases among the elderly, myocardial infarctions, which are heart attacks, hospitalizations for dehydration, and then issues with people obtaining medical care, medications, and medical equipment, so being able to maintain their normal standard of care. In my own lab, we've been doing some research on this. This is one study, and the first thing that we did was we took over 150 different counties across the United States, all with a high population. And we took all of the storms over more than a decade, and we identified the cases where the storms that we had in the study brought the strongest winds to the counties that we had data for. So these are the cases of those 10 strongest events, and you can see it's some storms you might remember the name of, like Katrina and Ike and Irene, Charlie and Wilma. And most of the places where we had data where there were strong impacts were in Florida or then Harris County, which is where Houston is. We had Medicare hospitalization records for everybody 65 and older in these counties, sorry, all the Medicare beneficiaries in the county 65 years and older. And what we did was we looked during that storm period from 2 days before to a week after, and we compared rates of hospitalizations in that population to similar rates in years without storms, with some other controls for things like the number of Medicare beneficiaries in the system at that point. So we're comparing within a city periods when that city was exposed versus periods when that city did not have a storm. Here I've got the wind speeds in meters per second for each of these storms. This is not the wind speed of the central storm. We actually modeled in each county at the county's population mean center what the wind speeds were in that county to try to get an estimate that kind of incorporated wind field a little bit more. And then over here, we have the percent increase comparing that storm period to unexposed periods. You can see that for many of these, we had somewhere in the 30 to 40% increase in the risk of Medicare hospitalizations for respiratory causes compared to non-storm periods. So it looks like this is something that might be happening again and again. Yeah? Meters per second, yeah. It's all going to be above tropical storm force. I might have to ask one of the meteorologists and one of the atmospheric scientists in the room if it would be
double miles per hour.
And 64 is the cutoff, I think, for a Category 1 hurricane. Is that right? Yeah. But again, all of these storms themselves were hurricanes that were up. Several of them were pretty strong hurricanes, and so these are the ones coming in. These are all, I think these are all at least at the strong gale on a Beaufort scale, where you would expect building damage, down trees, things like that, at the very least. So next we took this and we looked not just at those top 10 storms, but at every case where one of the counties we had data for had wind speeds of over 21 meters per second. And that is just a little bit over 34 knots, which is the cutoff for tropical storm force. For respiratory outcomes, we found an increase on the same day, about a 15% increase on that day, and then an even higher increase in the days after. So as we go across this lag, 0 is the day that the storm was closest to that county that we were studying. And then these are days after the storm to a week after. And these are days before the storm. So we saw that this increased risk persisted in the week after the storm. And we also, interestingly, found that there was an increased risk in the days before the storm And we went through and did a lot of analysis to try to make sure that that wasn't something indicating we had our models wrong. And we're pretty confident in this effect. This is a period, we now know a day or two out, where a storm is expected to go. So there are a lot of preparations that are typically done in advance of that, that it could include evacuations, but also boarding up houses and a lot of other things. We also looked at cardiovascular hospitalizations. Interestingly, we actually found a decrease on the day of the storm for this outcome. But then we find a pretty persistent increase in the period after, which lines up with what they were finding case by case in Hurricane Andrew, with events happening in the cleanup period for some of those cardiovascular outcomes. All right, so as a piece of this, so one of the things that makes it a little tricky to do this is these storms are multi-hazard events. And there's wonderful data out from the atmospheric side on a lot of these events, but then a lot of the data that we have for health is aggregated at the county level or other levels of aggregation. And so the work that we've done brought together somebody from Sierra and then some folks in engineering, a couple of people from NASA who helped with the precipitation data, a large team to try to meaningfully pair up this atmospheric science data with the health data that we had. And we felt like it was important to make sure we share that with other people so that other health researchers and people researching social impacts could study that as well. And so one of the things that we put out was some open source software that includes all of this data from 1988 right now up to 2015 for most of the outcomes. Rainfall we have to 2011. And it has at the county level things on modeled wind speeds, precipitation, so cumulative precipitation for a period surrounding the storm. It's also linked up NOAA storm events data on floods and tornadoes with the storm tracks geospatially so that this data can be paired up for human health data. All right, I will wrap up there, and I'm happy to take any questions that you have.
Remember, we need to use the microphone, so I'll pass it around.
Thank you for an excellent presentation. Is there a thought about linking your findings to some policy of some way of making sure the hospitals in the catchment area would be better prepared to deal with these pathologies?
I think that would be really interesting. I think there are also some very important decisions that have to be made when a storm's coming in terms of evacuating populations that are either in hospitals or in nursing homes. So I think we're at early stages for this research, where right now we're focusing on trying to characterize things well, but I think ultimately those are really important directions to do, to try to think about how to use this for evidence-based decisions for preparing and responding to a storm, for sure.
Yeah, that was a very enlightening talk. Thank you for that. I had a question on, I think it was slide 31 with Hurricane Maria showing the timeline.
Yeah.
Oop, there it is. Is that significant, that little pulse before Maria comes? Like
So,
distress
Yeah,
type?
I've showed this particular slide several times since it came out in various and sundry talks, and there have been 2 times I've been asked about that.
Right.
One was giving a talk to the Department of Atmospheric Science out here at CSU, and now you're the second. This was Irma, I believe. Hurricane Irma came in right before, and the timing lines up for that. I don't know if anybody's done a real clear analysis, if it looks like that's the cause of it, but.
Just wondered if, people thinking about the storm who may already be in a situation of,
This is maybe a week before, so I think this might be too soon for them to have had a good forecast that the later storm was coming. No, I think that was right when Irma came through.
also, have they thought about building up the berms around the lagoons, just adding dirt as a cost-effective way to
I
reduce
don't
the
know. I know that there has been a lot of research going on with it, but I don't know if there was much research on trying to harden the existing technology versus trying to do something that's totally different. So I'm not familiar enough with it to know if that's a path they've taken. that was for Galveston. That was the solution after 1900. They did the big seawall and they raised the whole city quite a bit. Okay.
How long would it take for the hog industry, small farmers, to recuperate after this type of flooding and all of that?
That's another really good question. I'm not sure. I think there have been some retrospectives and kind of oral histories coming out now that we're at the 20th anniversary. So it might be worth looking online for some of that, where they're going back and talking with people to see if they have ever recovered from that. But again, I grew up on a farm just north of this, and our farm did beef cattle and corn and soybeans and cotton and peanuts. But again, I can imagine for many of these families, there's not a lot of extra buffer in terms of finances or ability to maybe cope with some of these. So I think that in some cases it might lead to leaving the farm and doing something different, but I'm not sure.
In the data that you showed for wind speed and fatalities, were those adjusted for other exposure metrics like rainfall or any other ones?
Yeah, that's a really good question. So, like here, we are picking this based specifically on that threshold of 21 meters per second. We also went through for this study, and we looked instead at a definition that was using rainfall, and then we looked at one that was using flooding for a yes/no based on listings in NOAA storm events, and then the same for tornadoes. We found the strongest association when you were looking at it in terms of wind, but just like, so a lot of people in our department study air pollution, and there you often get correlated exposures from lots of different air pollutants. And so there's been a lot of research on the methods for trying to look at that and get estimates of the different components at the same time that you're trying to get a holistic picture. And I think that's a really important next step for some of this research on hurricanes. We have this exposure out on all of these different hazards now, so it could be really interesting to do some questions like take things where there was a high rainfall and split into the ones that had concurrent high wind speeds versus ones that didn't, and see if you're seeing some effects for rainfall even when you didn't have high winds, for example. So I think, yeah, there's a lot to do to explore that.
Other questions?
This is fascinating. From a policy perspective, again, would your tools be amenable to be used so that budgets and to take care before and after the cyclones are allocated to states? Could that be used as a tool to push for additional economic resources?
I think that the stuff that we've put up, so we've aggregated it to the county level for this research because that's really a level of aggregation where you can get a lot of economic and health data. So I think it's really well suited to do studies to explore what links there are for that, looking back over lots and lots of storms. So you can start seeing things that are consistent across a lot of storms or things that are different across different storms, and if they're characteristics of the storm, they're linked with those differences. I think that there are other resources that are probably a little bit more refined that would be better for those immediate after the fact impacts. So I think that there are folks at organizations like NOAA that and USGS that does some of the stream gauge data that probably are better able to connect in the immediate aftermath for trying to decide where needs are in terms of that.
Thank you.
Anyone else? Other comments? Yeah, go ahead.
It seems like at this day and age, the ability to mitigate climate change seems to be over with the current administration. So everything seems to be about adaptation and resiliency. So we know there are massive sort of observable effects of these hurricanes, and then there's better information on additional effects that we might have thought were out there, but no one had quantified yet, and you're doing a very good job on that. So are there, is there anything that the federal government or state governments aren't doing that they should be doing? Or it's too early to tell?
Yeah, so again, I think one of the areas where we're finding stuff that maybe people had an idea about but wasn't well characterized is in some of these risks for populations like the elderly who already have a lot of existing conditions that might put them at risk of a trigger leading into a respiratory death or cardiovascular death or hospitalization or something like that. And so in the case of heat and heat waves, which is an area also associated with climate but has kind of like a longer history of loads and loads of multi-event epidemiology, in that case, the results from that has helped to inform things like the plans that communities take during heat. So there's some communities now where just like during cold, they won't shut down your electricity for not paying. They also restrict if it's really, really hot, they won't shut that down and take somebody's air conditioning away in a period where they might be really susceptible to outcomes. And they've also done things like targeting the elderly for outreach during extreme heat days. So that conversation I think shifted a lot from the idea that the main risk was heat stroke with people who were working outdoors and possibly a lot of it being more in people who are working age to there being a big recognition that not only is that an issue, but there's also this really large issue of people dying from a cardiovascular outcome or respiratory outcome that was triggered by the heat.
Can I ask a question?
Sure.
Is the moderator allowed to ask a question? So I'm trying to decide how to ask this, but in a lot of the talk about climate change right now, kind of at county and higher levels, a big issue is insurance and home insurance, health insurance, et cetera. And insurers are tripping over their feet trying to determine how to predict how do we insure people, and sometimes people aren't getting, the coverage they need, et cetera. You know the story about this, especially in places with flooding and people losing homes, et cetera. But I was curious, has any of the research you've done connected with the insurance industry, or are they trying to get this from you, or
It's a great
I don't know what
question.
that dynamic is.
I'm very much an open source advocate, and so getting to this data that we did, it's a little bit hard to get consistent data across a lot of storms on hurricane wind speeds. A lot of times for the ground-based monitors, they blow away. There's some products like H-Wind, but that is not publicly available. It's not something that we could have shared and posted ourselves. And so we went through and working with Andrea Schumacher at Sierra, as well as some engineers who forecast power outages or predict power outages when a hurricane's coming. We took some Fortran code that they had that was modeling wind speeds, and we refined it a bit and released that as open source our software as well. And so that's what we're using for these wind speeds when we do it. And some validation of that as well, comparing with the maximum wind radii from some of the NHC products. But yeah, I got an email one day from somebody in Switzerland at a reinsurance company there. It was like, well, could you add this piece into your model? And I was like, well, I don't have time right now, but you could. And he emailed back and he's like, I did. So I asked him to post it and he's like, no. But he was using it for his own stuff. I got an email from some folks at the Central Bank of Mexico who are using that as well for Pacific storms. And we haven't refined it much for speed yet, so I think they'd had it running for a while on one of their servers. But one of the pieces that we're doing, we've gone back, and it's programmed in R right now, which is very transparent, and a lot of people know that language. But some of the parts that take a little longer to run, we're putting in C, and we'll interface through to speed it up a little.
Interesting. I just see that as something that's going to be happening, become more of either a problem or a solution for different industries coming together. Yeah, of course.
So I know this is a little bit off topic, but I've been thinking about the wildfires in California and specifically with the electric utility shut off.
Yeah.
And I was curious if you had any comments about the relative danger, especially to people who do have pre-existing conditions, of doing that sort of preemptive shut off versus like the impacts of the event itself.
Yeah, well, so I actually did a study a little while ago. There was a big power outage in 2003 in New York that wasn't caused by any weather or anything like that. It was caused by some issues in the Midwest. And we did find that there was a substantial increase in mortality from that. And a lot of it was cardiovascular impacts. During some of these storms, anecdotally, you will read a lot about people who are on respirators who need to plug in going to hospitals to be able just to access the electricity to continue their care. So some of that spike that we're seeing in respiratory might not be that there's an event that's precipitating it. It might be that they feel like they need to go in somewhere to continue their normal care. So I think that would be something interesting to try to look into a little bit more. But yeah, that question should certainly be coming up in the context of the California wildfires and the different steps that they're trying to take to try to limit impacts of that. Anyone else?
Okay, thanks for coming, and thank you so much, Brooke, Dr. Anderson, for being here, and we really appreciate it. And we can hang out a few more minutes if you just want to have some informal discussion. But thank you, and let's give her a round of applause.